living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
As we age, we tend to take more and more medications to treat our health conditions, but using multiple medications puts us at greater risk for harmful adverse drug events. There are 3 types of medications that can be especially dangerous. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Today we talk about the big 3 medications for adverse drug events and what you need to know if you're taking them. Stay tuned. Welcome back and thanks for staying with us. According to the Centers for Disease Control and Prevention, adverse drug events are responsible for more than 700,000 emergency room visits every year. And if you're over the age of 65, you're twice as likely to go to the ER for adverse drug events and almost 7 times as likely to be hospitalized after an emergency visit. Joining us this morning is Angie Woodmansey, a pharmacist with Mountain Pacific Quality Health. Angie, thank you for being here.
You're welcome, Lisa. Thank you.
Absolutely. So before we dive into this conversation, I think it's important to take a step back and make sure folks understand what an adverse drug event is. Can you define that for us?
Sure. Adverse drug events are any injuries or harms that may happen to someone as a result of taking a medication. It can be a broad spectrum of adverse drug events. It could be anything from a medication error, where let's say you go to the pharmacy and fill a prescription and you come home and realize you got the wrong drug. Mm-hmm. It can be an adverse drug reaction, which is a side effect where you get a medication, you start taking it and you feel drowsy and dizzy. That would be an adverse drug event. Also, drug interactions. If you're taking 2 medications and one medication can make the other one not work as well, that's also an ADE. And then lastly, overdoses. They can be accidental. You know, you can get your prescription bottle, look at the directions, think you know how to take it, and then you realize later, oh my gosh, I took double the dose I was supposed to take. So they can be usually, not intentional, and they can be very frequent.
Excellent. So can you give us some examples of actually where ADEs may occur? What types of situations,
Sure. Unfortunately, adverse drug events can happen anywhere. In the healthcare setting, you can see it happen in hospitals, it can happen in nursing homes, it can happen in your own home. As I just described, you can read your prescription drug bottle wrong. Another area where it can really happen is with transitions of care. So if you've been hospitalized and you're getting discharged to home, your hospital doctor might write for a whole slew of new medications. And you go home and there you have your old medications and you might think, oh, I'm supposed to take both because your doctor didn't know you had those others at home. And of course that could lead to drug interactions or compounded. They could be very similar drugs and you could take too much. Sure. So that could be a problem. Another community that might be at risk would be rural communities. Oftentimes they are lacking appropriate healthcare providers, they just don't have enough. Sure. And anytime you're in an underserved situation like that, adverse drug events can be more likely.
I understand that unless we do something to the number of adverse drug events is anticipated to continue to grow, as time progresses. Yes. And I'm assuming there are multiple reasons for that. Can you talk about that?
Yeah, there basically are 2 major reasons. The first reason would be that as we age, we take more medications. Sure. And right now we have the largest generation, the baby boomers. They're reaching an age now where they're seeking health care, maybe getting put on medications. So we just have a large number of people on meds right now. And then the second reason would be that there are a lot of medications that are now on the market. Every year, more and more get released to the market. And last year, they had almost it was like a 21-year high record. They had 46 new novel medications released, which was double from the year prior. So just with more people, more drugs available, it just sets us up for more adverse drug events.
That makes sense. So can adverse drug events be prevented?
Well, they can not be prevented completely, but there are certain things that we can do to try to reduce our risk, especially as doctors and pharmacists. And so doctors have moved to computerized order entry programs, which have been very beneficial in reducing some errors. When the pharmacist gets that script, they don't have to interpret the handwriting and all of these things. So that's one way. Doctors also, at every appointment with a patient, they really should do a complete medication list. They should ask you about your over-the-counter medications. They should ask you about your natural supplements you might be taking to make sure that there aren't any problems or drug interactions there. As pharmacists, we can play a great role in educating patients about their medications, all of the side effects that could happen, making sure they understand the regimen and how to take it. We also look for drug interactions. We can also screen for any types of side effects. And so our job as a pharmacist is to make sure that what you get on your bottle is correct and that what is on the label is really what's in the bottle. And so that is our job, and we need to look at how we can prevent errors in doing that.
Excellent. So how about patients? What can they do to help avoid adverse drug events?
Well, probably the biggest thing as a patient is to keep a list of all of your current medications. You know, the over-the-counters, the natural supplements, vitamins, you name it. Put it on your list and carry that list with you. Keep it in your wallet or in your purse so that you have it. And take it to your appointments, take it to your pharmacy if you need it. And also make sure that someone you know knows about this list and knows where you keep it in case you have a medical emergency and can't speak. They can just pull it out and say, these are what that person is taking. Another way to reduce risks is just be an advocate for yourself. Yes. Ask questions. You know, when you get a new medication prescribed, ask why. Ask could be some of the side effects. Should I take this with food or should I not take it with food? You really want to look into all of those types of things. And also ask if your drug might need any frequent blood monitoring and just really be an advocate.
Excellent. So what about those folks who are on a lot of medications? Are there any tips that you might have for folks to help them stay organized and keep their medicines straight, even knowing that some of those medicines might look exactly the same?
Yeah, it can be so confusing. And you know how I mentioned that list?
Yes.
I recommend even on that list, maybe even sometimes making a little visual chart for yourself. Like, okay, in the morning I take these meds, in the evening I take these meds, just to map it out and see it, especially when you're starting a new med. And then, of course, pill box organizers are very helpful. They can have AM and PM boxes, and it can kind of help you keep it straight. You fill it once a week, and then that can tell you if you've missed a dose.
Wonderful. Well, we're going to take a quick break.
Okay.
We'll come back and talk some more in just a couple of minutes. Stay tuned. We'll be back shortly. Welcome back. Before the break, we talked about adverse drug events, or ADEs, and some general tips on how you can keep yourself out of the ER or the hospital. But if you take medications for diabetes, an anticoagulant, or an opioid, you need to pay special attention. These three types of drugs are responsible for the most ADEs among older Americans. Angie Woodmansey, a pharmacist with Mountain Pacific, is still with us to talk about these medications. Welcome back again, Ange.
Thanks, Lisa.
Thank you. So let's start with diabetes medications. What diabetes medications typically cause the most adverse drug events?
Well, there are typically two categories of drugs that cause the most adverse events in diabetes meds. The first would be insulins. Insulins work by lowering your blood sugar, and of course that's why a diabetic would take them, but unfortunately sometimes it can lower it too much, and then you can get hypoglycemia or low blood sugar, and that can lead to some serious complications. The next category of drug would be oral diabetic pills called sulfonylureas. These work differently. They work by stimulating your pancreas to release insulin, but because insulin's involved, you're again at risk for hypoglycemic symptoms. And common sulfonylureas would include such things as the glyburide or glipizides, glimepirides. Those are the more common ones.
Okay, thank you. So let's talk about the signs and symptoms of hypoglycemia.
Sure. Typically with hypoglycemia, it starts out with some early symptoms, and those can be you feel shaky, clammy, have a headache, feel hungry, and then they can progress into more severe symptoms where you might start feeling weak, you might not be coordinated with your walking, you can have confusion, slurred speech, and blurred vision, and that is of course much more serious. And it's interesting to note that half of hypoglycemia incidents happen at night, and those are that's called nocturnal hypoglycemia. And so if you are a diabetic who takes insulins or sulfonylureas and you wake up in the night and your sheets are wet because you've been sweating, you have a headache, you should be aware that that could be a sign that you are having hypoglycemia and that you would need to seek treatment.
So it's quite important, to know that what the signs and symptoms are, and then can you talk about how it is dangerous?
Absolutely, yes. It can certainly proceed even from those symptoms I just described, even to more severe symptoms. You can start having palpitations and arrhythmias. You could stumble and fall and have a major accident. You can have severe nerve damage or lifelong brain damage as a result of this. It could lead to a coma and, worst case scenario, death. So it's very serious.
So it's important to know how to prevent this or how to actually treat it if it happens. What does somebody do?
Right. It's super important to just recognize the symptoms so that you're aware and to be ready. If you're diabetic on those meds, make sure you carry with you a readily available source of sugar or glucose. It can be in the form of glucose tablets, which a lot of diabetics carry, or it can just be carrying around a little, a snack, a sugary snack, a banana, even some apple juice or something that you can take if you start to feel those symptoms. But if you progress to the more severe symptoms, you may not be able to help yourself because you're confused. And so it's important that the people around you are aware of hypoglycemia symptoms so that they can help you and that they can call the ambulance if needed.
So can folks do something to help prevent these types of ADEs if they're taking a diabetic medication?
Well, I think just again, education is so important. The one thing to really keep in mind is to pay attention to certain situations that could cause your blood glucose to lower even further. That would be if you've had a recent change in your diet, or you forgot to eat dinner that day, or you went on a hike up Mount Helena or something, and had more exercise that day.
Sure.
You would want to factor all of those variables in. Even having an infection or a fever can increase your risk, or drinking alcohol that day can increase your risk for hypoglycemia as well. So you'd want to recognize situations. You'd want to make sure that you are taking all your diabetes medications exactly as prescribed. It can be complicated, especially with insulins and knowing how much to inject and when. So you'd want to be educated. You want to make sure that you monitor your blood sugar frequently as your doctor has prescribed so that you can see if there's any trends where your blood sugar is starting to drop.
So one of the first line medications for diabetes is metformin. Does it work the same as the sulfonylurea group?
Well, it does help lower your blood sugar, but it does it in a different mechanism of action. Sulfonylureas actually tell your liver to make less sugar. So insulin is really not involved in that process. So you're not at risk for hypoglycemia, at least as greatly as you would be with the other medications.
Thank you. So let's move on to the second type of medication we're focusing on today, which is anticoagulants. And can you talk about what are they and when are they prescribed?
Absolutely. Anticoagulants are oftentimes known as blood thinners. Probably the most common and oldest one that you'll hear about is warfarin or Coumadin. And recently there have been some novel anticoagulants that are oral that have been released. These would include such things as Xarelto or Eliquis. Let's see here, there's Pradaxa, Savasa. There are quite a few, and they've just come on in the last few years. But the bottom line is whether you're taking an old one or a new one, they work to help prevent clots or to help treat clots.
Thank you. So I think we have time for one last question before we need to break. And can you talk about, we know all medicines have benefits and risks. What are the heavy hitter risks with anticoagulants?
Well, just know that if your doctor's prescribed it, they're probably prescribing because they think the benefits are greater than the risks. The risks, though, would be if you take too high of a dose, you would have a greater risk for bleeding. So you'd want to watch for nosebleeds or excessive bruising. Another risk is if you take too low of a dose, you could increase your likelihood for a blood clot, which could lead to a serious medical emergency.
All right, thank you. So I think we're going to pause here for a quick break, and then we'll be back in just a few minutes to answer some more questions.
Wonderful, thank you.
Thanks for staying with us. We'll be back right after these messages. Welcome back. We're talking about the 3 medications that cause the most adverse drug events, or ADEs, among older adults. Angie Woodmansey is still with us. Welcome back again, Angie.
Thank you.
So we were talking about anticoagulants before the break, and maybe you could mention how a person would know how much of that drug that he or she could take safely.
Well, that is for warfarin specifically. It is determined by a blood test that you have done. Your doctor will order it. It's called an International Normalized Ratio, or INR. And they'll measure that level, and it tells them if you're at the right dose. They typically look for a range somewhere between 2 and 3, but that can vary depending on your medical situation. And based on how your level comes out, they'll tell you to increase your dose or lower your dose. And that can get kind of complicated because with warfarin, sometimes they might say, okay, I want you to take 5 milligrams on Monday, Wednesday, Friday, and then 2.5 milligrams all the other days of the week. And that can change every week, so that it's complicated. But with the newer novel agents, however, it's much more simple. There might be some initial blood work needed, but then after that, the dose results in a pretty predictable blood level, so they don't have to monitor as frequently.
So how often, for warfarin, for example, would a person have their blood tested?
Well, when you first start it, you would want to get tested at least every 1 to 2 days. And then if you're doing okay, they might bump it up to 7 days. And then finally, once you're stabilized in that proper INR range, then they might have you go 4 weeks or even 6 weeks, depending.
Okay, great. So other than getting regular blood tests, how else can folks who are on anticoagulants help prevent ADEs when they're taking those?
Well, it's really important to follow your instructions exactly. As I said, the regimens can be super complicated, and so you want to write them down. The minute your doctor tells you, you write it down, keep it posted somewhere. And because your dose is always being adjusted, you might have 2 or 3 or even 4 bottles of warfarin at home, all different strengths. And so you will want to always make sure you check the strength before you pick the bottle to make sure you're getting the right dose. And another thing is just, always remember that this can interact with some drugs, particularly aspirin. Aspirin also has some blood thinning properties, so you wouldn't want to combine the two unless you talk to your doctor about that first. And then also diet is a really big thing to keep in mind when you're taking warfarin. Vitamin K, which can be found in green leafy vegetables or things such as spinach or broccoli, can actually interact with warfarin. It can decrease the warfarin's effectiveness. And so what's really important is that you maintain a consistent diet. And so that means you still can have these foods, but you just need to tell whoever's monitoring your warfarin that you're eating it. And just really try to be consistent. Don't suddenly binge and eat, spinach salad three days in a row if you normally don't.
Okay.
Your doctor can adjust your warfarin around your diet, but it's much easier if you maintain that consistency.
Excellent. So last but not least, let's talk about opioids. What are they and when are they typically prescribed?
Sure. Opioids are controlled substances, and they are just one type of a pain medication. Some of the more common ones you might have heard of are oxycodone or OxyContin, or hydrocodone-containing products such as Norco or even morphine. And there are many reasons why a healthcare provider might prescribe these. They can be prescribed for an acute injury or after an operation or surgery. They can be prescribed for certain severe chronic pain situations, chronic back pain or chronic arthritis.
And why are they potentially dangerous? Can you talk about that, Angie?
Yeah, they have a great risk for side effects. So opioids can cause you to have, they can slow down your breathing. And so you might be taking it and your breathing can slow down, your heart rate can slow down. And so therefore, if you take too much of it or you're not responding well to it, it could slow your breathing down to the point where you could stop breathing. It can also cause drowsiness, dizziness, confusion, which can cause problems with your daily life. You can also build up a tolerance to these medications. So you may find that you've been stable on a dose and all of a sudden it's not working for you anymore. So you have to keep creeping that dose up and up and up. And lastly, probably the most important big thing that you hear about in the news is that opioids can be addictive. So that's really important to keep in mind, and they can lead to overdoses.
So if I'm prescribed an opioid, what important questions should I talk to my pharmacist or doctor about?
The first thing you want to ask is, how long do I need to take this opioid? That's super important because I think they're just now realizing that you shouldn't maybe take them as long as they typically thought you should take them for, especially like an acute injury. For an acute injury, really 3 days is probably the most you would need, or even post-surgically, probably no more than 7 days. So you really want to ask about that. And also talk to your doctor about the risk versus the benefits of taking the opioid, you might want to ask, is there a safer alternative that I could take that might help me with my pain just as well? So that's really important. You know, and just talking to your doctor is just the other key piece with all of this.
Absolutely, always. Are there some risk factors that predispose someone more to an opioid ADE?
Sure. If you go to multiple pharmacies, multiple doctors, it's hard for all of them to stay in the loop and know what you're taking, and so they might miss possible drug interactions, and opioids can interact with some meds. So I recommend that you avoid that and try to stick to one pharmacy if you can. Also, if you're taking a high daily dose of opioids, that sets you at a greater risk for adverse drug events. And also, taking it with alcohol is usually not recommended because alcohol can also slow down your breathing, and so it can compound the side effects.
Yes.
And that can also happen with certain prescription drugs such as benzodiazepines, which are alprazolam or Xanax or Valium. Those medications also have a side effect of possibly slowing down your breathing and your heart rate, so could be dangerous taking the two together.
All right, so we've already talked about some general medication safety tips for preventing adverse drug events in general, and we've talked about the big three. Is there anything else that you would want viewers to know when it comes to preventing these types of ADEs?
Oh, sure. I think the big thing to know is that the more you know about your medications and the more you talk to your healthcare providers, the more educated you will be.
Yes.
And the safer you will be with your adverse drug events. So like I've always said, be very proactive. And then lastly, an interesting tidbit is that as we age, we process medications differently. Yes. And so medications that you normally wouldn't have a side effect to, you may find that you're now suddenly having side effects to them. So if suddenly some new symptoms appear, you might want to talk to your doctor about if they could be related to the medications you've been taking.
Great, and I know there's a national focus effort right now on preventing the three big ADEs. Just in a few sentences, could you mention that?
You bet. Yes, there is a huge initiative. They're honing in on which medications are more likely to cause problems. They're also honing in on what processes that maybe where there are problems at. Like, for instance, they identified that there could be a problem with how we were writing prescriptions
Sure.
and getting them to pharmacies. So they're recommending computerized
Yes.
order entry and computerized transmission to pharmacies, and that's been a huge improvement. And also, if you have hospital pharmacists, they're recommending that hospital pharmacists make sure that they're part of the care team of a patient that's hospitalized, that they do rounds with the doctors, and that they're involved in making decisions on appropriate treatments.
Excellent. Thank you so much for your time and expertise today.
You're welcome, Lisa. Thank you.
You bet. Thank you for tuning in this week. We hope to see you next week again. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.